Hello, it's Dr. Rhonda Johnson, and today is Sunday, November 15th, 2020. Well, today I'm going to be talking about self-defense and self-preparation. You know, I've been talking about planning for this pandemic since it began, and pretty soon we'll be seeing over 200,000 new cases daily. Remember, the coronavirus has mutated, which is making it a lot more contagious. And people are indoors more, which means the airborne transmission route is higher. You know, you're hearing a lot more talk about lockdowns on television. Well, I don't think about it as a lockdown. I think of this as self-preservation and self-defense. You know, I have portrayed this virus as shopping, as looking for its next meal, but I want to introduce one more thought to you today about thinking about this virus as a thief. Yes, a thief that is coming to steal your peace of mind, steal your breath, and possibly destroy your health or the health of your family members. The virus thief has a master plan, and it's to do one thing: to replicate itself in any available human host. So how do we protect ourselves against a thief? Well, many of us make plans, right? We have home security systems, we have video cameras, people take self-defense classes, and now record numbers of people are arming themselves with firearms. So I'm asking you to be preparing against this viral thief and have a self-defense and self-preservation plan against this virus. Now, you may not think this is necessary. I know many people have been told that this virus is no worse than the flu. But let me ask you to look at what's happening in El Paso, Texas. Hispanic residents make up 83% of the city, and they're also accounting for 93% of COVID cases and 91% of deaths. Now, you may say, what's El Paso got to do with me? Well, I don't know what your local transmission looks like. Here in Pennsylvania, recently, more women have tested positive than men. It could just be that men aren't getting tested. And the virus is hitting white people between the ages of 20 to 59. Currently, they have the highest number of cases. Now, it could be that other people just aren't getting tested. Well, what do we know about routes of infection? Well, in El Paso, the Public Health Department has done contact tracing, and they have attributed 35% of the COVID infections to people being in contact with other people in retail environments, 25% in dining and restaurants and bars, 20% to travel, 10% to parties and gatherings, and 8% to people working out at gyms. Now, in other parts of the country, small family gatherings are accounting for significant transmission. No matter where you are, if you're in the highest risk age groups, that's folks between the ages of 60 and 85 and up, please go into self-defense and self-protection mode. Now, if you're not sure what to do, I can give you a few suggestions for your self-defense strategy. Number one is the flu shot. The flu is here. Here in Pennsylvania, there are already 360 laboratory confirmed cases. You don't want to get the flu and coronavirus at the same time. It'll be too much for most people's immune systems. Second self-defense strategy is taking vitamin D3 to help keep your immune system as healthy as it needs to be for all of those cellular defense they have to mount. Third is to prepare. Have your household supplies stocked up, including non-perishable items, and 2 weeks of your medication supplies, and plenty of foods to stay hydrated. 4 is to be very intentional about your activities outside your home. Please avoid any celebrations. Please consider ordering takeout meals and working out at home for a little while. The fifth self-defense strategy is to enforce all mask wearing. Folks, if somebody comes to visit you, limit their time, Keep an extra safe distance. Have them use hand sanitizer and open up the windows while they're at your home. 6 is maintain hand and good home hygiene. And then don't forget to take good care of your conditions if you have them, your medical, and don't forget about your mental health appointments. Many healthcare professionals are offering virtual services during this time, telehealth visits and calls. And lastly, keep up your mental health. Stay connected to your friends, your family. Engage in relaxation activities. Practice your faith. Try not to worry or to be anxious. And as more and more information comes out, pay attention to the information about the COVID vaccine. Be thinking about it. Ask your questions and make your decisions about whether you're going to get the vaccine when it becomes available. That's my message for today. Again, be on defense, self-defense, and self-preparation and self-preservation. This is Dr. Rhonda Johnson. My views are my own. Stay safe and have a blessed day.